Mainly everybody are phobic about the term asthma. Our parents, when they come, they want to hear any other diagnosis other than asthma. But off late, especially in the last 6 months or so, since the schools have started, we are noticing an increasing trend of this asthma problems. So asthma mainly in the children, we see it as it could present as wheezing per se, excessive dry cough, mainly which is more in the night time, early mornings, and it may be associated with blocked nose, runny nose, sneezing, because the upper airways also would be involved. Sometimes children or young adolescents, they may present like exercise post running, playing, or walking for a long distance or climbing stairs. They may have difficulty in breathing or tightness of chest. So asthma has a varied presentation. It's not single diagnosis, presentation alone. So mainly it is associated with inflammation, the swelling of the airways. When an asthma attack is triggered, the airways are usually circular in shape, but it becomes inflamed and the size of the airways through which they can breathe actually goes down. So it's mainly against resistance somebody is trying to breathe. That's why the symptoms tend to be worse when the triggers are more. Asthma mainly it could have varied presentation. It's not just disease of the childhood alone, but at times if it starts early in the childhood, they may become better as they grow older, or it does turn to persist into adulthood as well. So it varied presentations. It could be cough, which could be night, early morning cough, wheezing, exercise induced symptoms. Sometimes going out to cold air can also actually trigger off breathing difficulties, or when they are exposed to some irritants like smoke, agarbattis or anything like that, and exercise induced symptoms. So I think it's a varied, we call it as variable presentations, but it's a chronic disease which affects the lungs mainly, and it can be effectively treated so that the symptoms can be identified. Need not be. I think the causes for asthma, especially in the younger children, less than 5 years, is a little difficult. It could be a varied presentation, but beyond 5 years or 6 years, it remains usually consistent, like cough, which is mainly dry, or exercise induced symptoms. Under 5 children, mainly they start off with like viral fevers. When you get some fever, mild cold cough, somebody will be having in their class, and post that the infection gets down, but this asthma triggers continues. So the challenge in diagnosing asthma in under 5 years is a little of a tricky situation, and but above 6 years or so, the symptoms usually remain uniform. For us, when we are practicing asthma or allergy, I think good patient education is quite important. So in pediatrics especially, it's not only true for the patient but also for the family. I believe in empowering the patients or the parents as to why we are giving any medications, because that helps them get on board, win their confidence, and also the need to continue the medications. So it could be mainly inhalers in the form of rescue medications or a maintenance medication which may need to be continued for a little longer time. Contrary to the stigma that the inhalers are quite harmful or addiction, it affects the growth or anything, that's all contrary to that. It's quite safe. Local action is quite very effective, and the need for other oral medications goes down drastically. Even the hospital visits, our clinic visits definitely go down. I think it's just good patient education along with the inhalers and necessary medications definitely gives good control of the symptoms and help them improve the quality of life. Definitely. Asthma, like as I said, it's a stigma. Patient accept the diagnosis of cancer quite easily rather than asthma. So in my practice, I say it's a very chronic disease. We tend to meet very often initially until we get the good symptom control. It's just that I think in our country, the awareness among our peers, among the population also is less. It is definitely getting better over the way because of awareness programs, everything, but we still have a long way to go. So in children, when we get patients, they say first thing is they're not ready to listen about dust mites or any other environmental triggers. food. What is the first food which is causing my child the problems? Many a time it leads to a lot of food avoidance and thereby affecting the nutritional quality of the patients. It's just that some foods like ice creams or soft drinks or some fruit juices, when they are a little cold in nature, when we drink it, the food pipe and the windpipe are next to each other. Just like similar, when we put cold water on the skin shrinks, right? Shrinks, and it causes shrinking of, because the cold water on the blood vessels make that reaction. Similarly, on the windpipe, when it is next to the food pipe, it causes shrinking of the food pipe transiently, and that predisposes, just like inviting trouble come, and for the any viruses or anything, it becomes like a raw surface on the windpipe. So that's how indirectly it triggers, but other than that, it is not a direct cause of the asthma attack. But anyway, when they are symptomatic, having symptoms, we do tell them to avoid all fridge items or any cold items. Asthma, we never use the word cure. I think all the patients want to hear that. But I want to promise that if they follow their patient and the doctor advice properly about medications, avoidance measures, asthma can be controlled, very well controlled, to an extent that the need for medications goes down drastically, even sometimes to be zero. So as I said, we are not promising cure, but it can be very well controlled with appropriate medicines and avoidance measures.